Sorry.
Oh, dearie me.
Somebody's going to be looking after you.
Thank you.
We are back with the West Midlands Ambulance Service
We've got a job.
as the paramedics take us to the heart of the action once more.
He's currently having a seizure in the back of the ambulance.
We're going to be all right. We're going to be all right.
Old friends are back on shift in Dudley.
We see everything from life to death and everything in between.
We do.
And for the very first time,
We're in and we're online.
we're taking you to Stoke,
This is where it's all going to kick off today.
where new crews face fresh challenges
Oh, you kidding me? Oh, they're going to be horrible.
and experience heart-pounding action.
Grab the kit, grab the kit.
Body-mounted cameras record every moment,
What's that?
showing you what goes on behind closed doors.
Still struggling quite a bit, aren't you?
Well done, you.
Don't shoot me. I'll try not to.
This is a paramedic's eye view of life on the road as they battle over 4,000 calls each day.
You need to keep very still.
Am I alive?
I think you're alive.
Okay.
You'll be on the front line with them as we take you inside the ambulance.
That's what I love about this job, though. You never know where you're going to go, do you?
Am I okay your side?
Oh, God. No.
No?
No.
No?
No.
Still no?
Still no.
Still no?
Still no. Go now.
Was that a quick go now? Is a learner driver? Go now!
Oh, look, you're flashing. 35 miles an hour in a 30 zone.
Oh, I love this bridge.
Get your belly fluttering.
Get your... Oh, I like that word. Flutter.
Flutter?
Love a good flutter.
Fluttering?
Are you ready? Here's the bridge.
Hold up.
Oh, it makes me feel sick.
In Stoke-on-Trent, it's another busy day for ambulance crewmates Anne Armstrong and Steve Eason.
You know, my arm is so itchy. It's nice though. Love
Anne is a clinical team mentor, helping to train paramedic students.
it. Have you got any ink?
Yeah. Massive one on my leg with all my kids and wife name on.
Under her wing is technician Steve, who started working for West Midlands Ambulance Service 9 years ago.
I didn't get my first tattoo till I was in my 30s.
Oh, God, no. I was 18 when I had mine.
They're en route to their next job.
COPD, breathing problem.
Oh.
There we go. Got a wee miss.
The patient's daughter, Sam, is waiting for them outside.
Hi. What's the name?
Susan.
Hi, Susan. My name's Anne. I'm one of the paramedics, okay? How are you feeling today?
Not good.
Oh, dear.
Not good.
Okay, what's happened?
Well, I just took the dogs out to put the field.
Yeah.
For a walk?
Yes. And I don't know, I just
Hello, sweetheart.
felt all.
Do you feel
Yeah.
dizzy?
Yeah.
Okay.
I do struggle with my breathing.
May I just have a feel of your wrist? Okay. Have you got COPD, is that right?
Yes.
COPD is a lung condition which causes breathlessness and chest pain. Susan felt these symptoms come on when she was out walking her dogs.
Have you got any pain at the moment?
It's hurting a little, yeah.
And how long have you had that for?
Half an hour.
So it come on, but
Three-quarters.
before you walked the dogs, you were fine?
Yeah, I didn't feel too good, you know. I just
All
felt
right.
tired.
Lie down in the field.
I've had to lie down
Oh,
in the field. When the sun
really?
came, I
I
felt faint.
Okay, what I'm going to do now then is I'm just going to do an assessment on you, okay? And we'll give you a full MOT and see if we can find out what's going on, okay?
You all
Okay.
right?
All right.
Yeah.
All right.
My auntie, her sister, out of hospital with a heart attack. So
We'll see to it.
Look. It's absolutely fine. Don't you worry about it, okay? Don't worry, it's fine. It's all right. Don't worry. I'm going to have a quick listen to your chest, okay? So if you just take me some breaths in and out. That's it. All right, just try and slow that breathing down a little bit for me. Okay, so take some nice, slow, deep breaths in and out through your mouth. Okay, let's have a look. How old are you?
70.
Okay.
I said 69 then.
Are you 70?
I was 70 in June.
Oh, you're same age as my mum.
Get used to saying it, yeah.
My mum isn't impressed when I tell everybody she's 70.
While doing a routine check on Susan's heart, Anne spots a very unusual reading on her ECG monitor.
What I do believe at the moment, right, I think what's going on, you've got a possible blockage within one of your coronary arteries, okay, in your heart. But don't panic, okay, because but don't panic. I'm going to take great care of you, okay? And what we're going to do is I'm just going to pop a needle in your hand. I'm going to give you some medicine, some morphine to help you with the pain, okay? When I saw Susan's ECG, I was quite surprised because obviously we didn't get the job as a chest pain, we had it as a breathing problem. So once I saw the ECG, I could actually see that she was having a heart attack. We've gone from a patient who possibly could have stayed at home with treatment to a patient who was time critical.
Where's Samantha?
She's just there, she's all right. I think she's just sorting your dog out. Okay, so I'll just give you a bit to start off with, all right?
With some pain relief to help ease her discomfort,
All right. Okay, and then sit yourself down on there.
the crew can move Susan onto the ambulance quickly.
Ready, steady, lift.
All right, all right. Yeah, I've got you. Sit yourself on there, okay? And then swing your legs up. Okay. Hi, is that CCU? Yeah. It's Anne, one of the paramedics. I've got a STEMI.
A STEMI is the most serious form of heart attack there is. It means that one of the major arteries to Susan's heart is completely blocked.
Straight to coronary care, Steve.
Yeah.
Susan's heart could stop at any moment. She will need immediate surgery. Meanwhile, Anne needs to open up her artery as best she can.
How's that pain? Have you still got it? Yeah. Okay, so have you had this before? All it is basically just dilation the arteries, okay? If there's a blockage within the artery, it's what we call a dilator, okay? So it'll just dilate everything. So what I need you to do is put your tongue to the roof of your mouth and I'll spray it just underneath. That's it, all done. I bet you've got all sorts running through your mind, haven't you? Don't worry, okay? Don't worry. We put all the sirens on just so we can get to the hospital quicker, because the sooner you're at the hospital, the sooner you can get treated, and then we can get you right, okay? It's very intense being in the back here with a patient who is having a heart attack. The likelihood they can go into cardiac arrest is quite high. You need to remain calm, because if you're not calm, the patient's not going to be calm. So you need to give the reassurance, everything is going to be okay.
On Blues and Twos, it takes just 10 minutes to get to hospital.
Oh, a little bit of a bump.
Anne and Steve take Susan straight to the cardiology department for the vital treatment she needs.
I actually like doing jobs like that.
It's a proper job, if
Yeah,
you know what I mean.
but we managed to keep her calm. She seems calm. She got a little bit teary at times, didn't she?
Yeah.
But I think, just with some reassurance. 40 minutes we got her in from the moment we arrived on scene to the arrival at hospital, which I think is pretty damn good.
It's quick, that is.
Pretty darn good.
Yeah, it's quick.
send me all round and back again? It is, isn't it?
It's nothing. It's pointing to the home.
I think we just splattered a bug.
Yeah.
Did you hear it?
I did.
Last thing you need on a Sunday morning, isn't it? Ambulance blasting through.
Everyone woken up. If I'm up, you're up.
Exactly.
In Dudley, Laura Hickman and Kerry Richards are on their break.
Oh, I've had it too quick. No, I've had it. Are you that hungry? Oh, I was hungry, yeah.
Kerry has been with West Midlands Ambulance Service for 8.5 years. Laura for 5 years.
Right. We're happy. I'm happy.
Kerry is married with a young son. Laura is recently back on the dating scene.
So I sent some flowers to a girl. Oh, you softy. I know. I don't like this date. This dating stuff wears me out. Why can't you just walk into a relationship? It's so much easier.
It don't get any easier. Dan still doesn't know what I don't like.
Is that the secret then? Not knowing what the other one likes?
He just plays dumb. He said, "You've never told me that before." I said, "Yes, I have. You're just deaf." It's selective hearing.
Selective hearing all the way.
Matters of the heart will have to wait as they get more information through.
We are going to 94-year-old Harold with cardiac chest pain. It's from 111.
So he's triggered the magic passwords.
He's used the words chest and pain, hasn't he?
He has. We are nearly there.
Yeah. Hello. Yeah, are you?
Harold, known to his friends and family as Pat, is being looked after by his carer and his son Dennis. As well as his symptoms today, Pat has dementia.
What's been going on?
This morning was fine. He's got pains in his chest and it's running to his shoulder.
Okay.
He had a quadruple bypass 30 years ago.
Oh, wow. Okay. Hello, young man.
Hello.
How are you feeling?
Bit rough.
Bit rough. How are you feeling rough?
Generally myself.
Generally unwell. What's this about your pain in your chest?
It comes and goes away.
All right. Pat was doing really well for 94 and he did look really well in himself. With the history of a quadruple bypass, I really just wanted to make sure that it wasn't his heart causing him the pain. So that was the first thing I had to rule out. Does the pain get worse when he coughs? Right, that's a good sign. Shows it's a bit more chest infection and breathing.
I thought that because the way he's talking, he was fine talking this morning. This is come on, just like that.
Yeah, he's quite sweaty as well.
Oh yeah, I said that on the phone.
He's as deaf as a post.
All right. Right, let's check you over, young man. How long have you been coughing for?
About 2 days.
About 2 days. I think you've got a bit of a chest infection. Oh. Have you had any paracetamol?
Yes.
He has.
He's had 2 paracetamol this morning.
Perfect. Has he got a hernia?
No, not as far as I know. That's his, where he had his gallbladder out. And it's,
Yeah. Look at your tongue.
It's got worse. It's got worse as he's got older.
Yeah.
Your hands are cold.
Right, I'm going to have a listen to your chest now.
After just 6 minutes treating Pat, it seems the crew have made quite an impression.
Lovely teeth.
Well, okay.
Lovely blue eyes.
Thank you.
That's the way you check it on me.
When we go out to elderly patients, one of the things that they most want is just to have a chat. It's part of the job and it's one of the greatest things we can do is listen to their old stories, especially when they're such charmers like Pat.
All right, nurse.
I'm fine, thank you.
I'm all right, Dad.
That's my favourite son.
My husband says that. He tells me I'm his favourite wife, but then again, I am his only wife, so...
That's what you hope anyway. So everything's all right. You don't need to be whisked off to hospital. Might have a UTI. It's not an accident or an emergency. It's a chest infection. So we can get the doctors to come and give him a prescription.
Laura calls 111 to update them and request a doctor to come out to see Pat.
We'll wait for these ladies to go, Dad, and I'll get you a few mussels.
He can have them now.
If he wants to have them now, let him.
Yeah.
It's fine.
Yeah, Dad. Right.
Right, let's pop this off your finger. Disturbing your muscles eating. Oh no!
You need to get
Not
in
on
that
the
bed
first
proper
date.
as well.
He'd break his heart to know I was a lesbian, wouldn't he?
I did just kiss him.
With the paramedics' health checks complete and Pat's doctors informed of his possible infection, Laura and Kerry leave him to his lunch.
Anyway, thank you very much.
No worries. All the best, Pat. All the best. Take care.
Keep out of trouble.
Bless him. Oh dear. All right, Dennis.
Thank you very much.
If
You're
anything
welcome.
changes though, if he gets any worse, call us back on 999. All right, mate.
People seem to think we're driving a vehicle that has like crazy acceleration on it and it's just a van.
Come on. Yeah.
Go on.
Come on, little truck, you can make it. Come on, I need a little help.
Oh my God.
Well done.
Thanks.
It's a roasting hot summer's day in Dudley, with temperatures reaching 30 degrees. Paramedics Stuart Ayres and Craig Baker are looking forward to the end of their shift.
Anything planned for later, Stu? No. I'm going to Fat Club.
Before they joined the ambulance service, Stuart worked as a barman and Craig was a builder.
I've got to tidy all my garden. I've got to finish my man shed off. It's got a working fireplace and everything in it.
Really?
No way. I've got to put all the electrics in. The wiring's already routed down there. But yeah, it's got a chimney, fireplace. I love it. Oh, hello.
They've just been alerted to their next call out.
So what are we going to, Craig? So it's an allergic reaction to penicillin. And see young Emily. Hiya.
Their patient is 34-year-old Emily. She's home alone, looking after her children aged between 3 and 6 years old.
Oh, he's got a stick and he's not afraid to use it. Hello.
Yesterday, Emily went to the GP and was put on antibiotics.
You enjoying your summer holidays? Yeah.
Okay, mate.
Mummy enjoying your summer holidays?
Do you want to tell us what's going on?
I started on penicillin
Yeah.
this morning,
Okay.
and last night I couldn't stop coughing all night and wheezing.
Yeah.
And today I just feel even worse.
Okay. So is your face normally as red as that? No, because you're quite red across the top of your brow.
Yeah, if I take this off, I start shivering though.
No, that's fine. You're quite warm to touch.
What's that?
Your heart rate feels quite fast off your pulse, to be fair.
Difficulty breathing, together with a rash on her face, could mean Emily's having an allergic reaction to the antibiotics she's been taking.
Hello, young man.
You don't, man.
I am a man, you are right.
And
Tonsillitis.
tonsillitis. So you've already got an airway compromise anyway. You make four. Okay, bob your tongue out. Say ah.
Ah.
Okay.
The crew need to work out quickly if Emily's breathing difficulties are down to the fact that she has swollen tonsils or if she's having an allergic reaction to penicillin, which is far more dangerous.
And how many tablets have you taken so far?
12.
12 of them.
2 tablets 4 times a day.
Mom, why have you got that on? What are you doing? Which?
I'm just getting the details up so I can know everything about your mum. Tells me everything I need to know.
Me.
No, your mum.
My mum.
Yes, your mum.
Have a look at Mummy's heart. Have a look.
If we're gonna, just in the first instance, if we're gonna pop you up to the hospital, what's happening with Kiddis?
I don't know, I've got no family nearby.
Oh dear. Any friends
The
that
only
could
thing
just...
I can do is ask the dad to come and have him, but he's got to come from West Brom.
Okay. Get him here as soon as possible, because if we do have to take you to hospital, obviously we can't take the Kiddis.
Paramedics Stuart Ayres and Craig Baker are at the home of 34-year-old Emily and her young children.
Have a look at Mummy's heart.
Emily has tonsillitis and is on penicillin, but may be having an allergic reaction to the medication.
If we're gonna, just in the first instance, if we're gonna pop you up to the hospital, what's happening with Kiddis?
I don't know, I've got no family nearby.
Oh dear. Any friends
The
that
only
could
thing
just...
I can do is ask the dad to come and have him, but he's got to come from West Brom.
Okay. Get him here as soon as possible, because if we do have to take you to hospital, obviously we can't take the Kiddis. Emily was quite sort of busy, had her hands full. She got young children running around. They were quite lively as well. An allergic reaction to penicillin can be really serious. While we were assessing, we were trying to establish whether it was absolutely necessary to take her to hospital or whether we could safely discharge her at sea, at home, because she got so much on her plate with the children. Just going to pop this in your ear, Emily.
I'll find my mum or something.
You know your normal temperature is like between 36.5, 37. Your temperature's 39.2, right? So by putting your bedgown on, you're actually insulating yourself, and your body's way of cooling down is by shivering.
No.
Having a temperature as high as that can make you feel absolutely lousy.
I'm gonna be forward.
Do you still feel wheezing now, Emily? Yeah.
Not as much as I have been.
Just lean back for me. Ah, that's it. Perfect. Nice, good breath in.
Clear.
Okay. Your chest is nice and clear. There's no wheeze or congestion on your chest at all.
If Emily was having a serious allergic reaction, her breathing would be getting worse, not better.
I'm going to suggest the way you're feeling is more down to the high temperature rather than the antibiotics. Once we'd done our assessment, realised that actually it wasn't so much an allergic reaction, it was more down to the fact that she was running quite a high temperature. We don't want to take people to A&E if we can help it. If you can treat somebody in their home environment, that's far better.
I think what you need to do is take regular paracetamol, so up to 4 doses in a 24-hour period, and keep doing that until your temperatures come down.
Every 4 to 6 hours.
Yeah.
They're lively, aren't they?
They always like this. Oh, God.
You could do with opening the window a little bit and getting a bit of cool air in.
Yeah.
Obviously, if you start to feel worse, don't hesitate, just call us straight back. All right?
As they can't stay to babysit, there's not a lot else the crew can do.
Right, sweetheart, take care of yourself, all right?
Any problems, just call us straight back, okay, Emily? Take care. Bye, ladies and gents. Bye. You assess a job twice, don't you? You assess the job in the truck on the first information you get,
yeah,
and then you reassess it when you walk in and you actually see the patient. Yeah. Those children were lively, weren't they?
Well, they're just. When I said to her, they always like this, and she said, yeah. Cool. 29 degrees.
And all's well.
What is the difference between a hippo and a zippo?
Go on.
One's quite heavy, the other's a little lighter.
Oh, Do quite like it though, do quite like it. Not as good as the magic tractor, is it?
The magic tractor.
Turned into a field.
In Dudley, Ben Fletcher and Lottie Stubbs are in the middle of their shift.
Oh God, I'm gonna sneeze. Or maybe not, maybe it's a shiver.
What was that? Was that a sneeze?
There was gonna be a sneeze, but I had a shiver. You just cancelled it out.
That's strange.
That was weird.
Ben and Lottie have been working together for nearly a year.
Are we going to do something for our anniversary of friendship?
Oh, we can do.
Yeah, I think we should.
What do you reckon?
I think we should go back to Alton Towers.
Do you reckon?
Yeah. Get balloons and everything.
The pair get information through from control about their next patient.
Oh, what have we got?
We've got an unknown male, adult, and he's outside, and he's developed a pain in his leg.
Oh dear. He's outside. Sudden pain and swelling.
To the entire leg.
999 activated.
On the journey, they find out more about their patient.
Recently been into hospital for a blood clot in their leg. States they also have an abscess on their knee.
Oh, there we go.
They've been called to a roadside location where the patient stopped to call for an ambulance.
Oh. Hello, mate. What's your name? Stephen. I'm Ben, mate. That's Lottie. What's going on, Stephen, pal?
I've recently had a blood clot in my leg. I've just walked in the shop and just really painful.
Whereabouts is the pain? All the back of your leg?
Yeah.
Right.
And it's just come up in the last couple of days.
Okay, mate. You think we'll be able to have a walk and jump on the back of a truck? A bit more private there, isn't it?
27-year-old Stephen was walking to his local chemist to pick up his prescription when the pain in his leg became unbearable.
Is it your first clot or are you quite prone to him?
I had one in the upper leg.
You had one in the other leg as well? Right. Bring your bum back there for me, mate. I'll bring this up.
Do you want to swing your legs up? So I missed your history. Did you say you were prone to having DVTs?
Yeah.
DVT, deep vein thrombosis, is a blood clot that often develops in the leg.
How long has it been swollen for?
It hasn't been this, it's only swollen up in the last couple of hours.
Walking around?
Yeah, I come out the house about 8:45.
Okay.
I sat down for a bit and the pain just wouldn't go. So then I phoned the ambulance.
Quick checks on you, okay?
Do you have any other medical history?
I don't know.
No.
Been to some antibiotics last week.
What's that for?
From what?
You had an abscess or something?
Just through the swelling in my leg.
Okay. Are you finished them now though?
Yeah, last week and you go down. But then this come off. Not so long back, this lump here. It's quite painful, that is.
Stephen was in quite a lot of discomfort and his leg was quite swollen and warm to touch. He was still recovering from a previous blood clot, which he'd got 4 weeks ago. The danger with blood clots is part of it can break away, and that's called an embolism, and that can travel back up and go into the heart or the lung or the brain, and that's what causes a stroke, heart attack, or a PE, which is in your lung.
How bad's the pain in this leg at the moment?
About 7 out of 10.
A 7?
Just throbbing, the problem burning as well.
Quite a bit of swelling around your ankle as well. How many DVTs have you had?
I had one in this leg and then just this leg.
Are they ever dislodged and gone up? No, they normally caught them in time. Alright then, let's just squeeze past you.
DVT is typically seen in people over 40. Stephen is only 27. The condition can happen in younger people and often reoccurs after the first onset.
Let's have a quick feel as well, is that alright?
So it was quite warm to touch. He's got pitting round his
Quite a lot of
ankle.
pitting, hasn't he? Yeah. Okay.
Have you told your doctor about your leg swelling? And what's he said? Has he arranged anything for it?
I've got another check-up for a couple of weeks' time, I think.
Couple of weeks. Did he arrange any sort of district nurses to see you? Any Clexane, nothing like that?
Clexane injections every day.
Stephen is already on anticoagulant medication, which will work to break up any potential new clots. Lottie needs to decide if he needs to be taken in or if he can go home to rest.
The main thing is this pain at the moment. You've got active treatment for your DVT. You've just had a recent course of antibiotics for that abscess, but it's not going away, so it's probably going to be another set of antibiotics. All your numbers are fine, so I couldn't see any reason to drag you up the A&E, to be honest. I think it'd be a waste of time, essentially, because you've got everything in place already. So my advice would be contact your doctor about that abscess.
Okay.
As long as you've got your active treatment and you don't suddenly start getting any shortness of breath, any pains in your chest, stuff like that, that's what you need to call an ambulance for. All right, especially obviously with this, that'll be the concern, and then a trip to hospital. Okay. But for now, you seem very well in yourself, essentially. Did you say you only live at the bottom of the road?
Yeah.
Do you want to lift up back there?
Yeah.
Yeah, we'll do that for you. Save you walking, because obviously it is very swollen.
With Lottie and Ben providing an excellent taxi service, they're happy for Stephen to go home, with strict instructions to go back to his GP.
It's all right, mate. Take care. Take it nice and steady. Obviously, don't walk too much.
Okay, mate.
Okay, thank you.
All right, nice to meet you.
All the
All the
best.
best.
He just walked too far, didn't he? And panicked a little bit.
Yeah, I think he just needs to get some rest for a few days and try not to overexert himself. He's already been treated for a DVT, so...
Yeah, he just needs to carry on with his medication.
Okay then, if you're a drag queen, what name would you have?
Oh.
What name would you have? What would you call yourself?
Sheila Blige.
Sheila Blige. Oh, that's clever. Sheila Blige. That's good. I like that. Mine would be Miss Dyson.
Miss Dyson. I'm not even going to comment or talk about that any further. Yeah.
Yes. Stand down.
You never worked here when it had the stand down message, would you? Stand down.
I think it still does sometimes.
The stand down man is like the sexy 999 woman.
Oh, she's a woman now.
It used to be a bloke going stand.
But yeah, it is a sexy 199 one, isn't it?
She knows she's sexy as well.
Yeah, you press it and she knows it to you.
It's the pause, isn't it?
999 mode activated.
No, it's the pause between the 999 mode and the
And then
activate.
is it?
It's like the tease. Like 999
say
mode.
It, say it.
Activated. Oh.
999 mode activated.
Ambulance technician Nick Griffiths and paramedic Adam Alcock are en route to a Category 3 call-out in Burton-on-Trent. A Cat 3 call is usually uncomplicated, but still needs an urgent response. Their patient lives 30 miles from their base in Stoke, and they're travelling there on blue lights.
Bloody siren, they're doing my head. A lot of the time I can switch off from them. It's like, I think that's just because of having kids.
What, switch off when your kids are screaming?
Yeah.
22-year-old Adam doesn't have any children. Nick has 4.
Bailey, my youngest, is like, Mum, 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 Mum.
Don't hear her. Mum.
The pair finally arrive at their patient's house.
I'll go in forwards and then...
Yeah, it'd be easy to just back it out there. Just watch this tree on the top then, because that's a very low tree.
Leave it there, eh, before we start making any scratches. Hiya, sweets. I'm sorry it's taken so. We've come from Stoke.
They've come to see a 72-year-old woman who's fallen and hit her head. Her husband Colin called for help.
Hiya, sweets. Oh, what a lovely house you've got.
What can we call you?
Janet.
Janet.
Janet just so happens to live next door to a paramedic, Gary. He's been looking after her till the ambulance arrives.
She's got up off the toilet, and the minute she got up, the next thing she remembers is being on the floor. She's hit her head on the side of the door frame.
Okay.
She's complaining of hip pain, so the left hip.
Okay.
And she is on warfarin.
Janet takes blood thinners as she has a known irregular heartbeat. She also has arthritis, which affects her mobility and balance.
What's the last thing you remember then?
I went to get up, and as I got up, I felt.
Fab. We'll redo your obs then.
All right then, Janet.
Yeah, okay, thank you very much.
All right, you're welcome, Gary. All right.
Sorry to call you again.
No, don't worry about it. What the neighbours fell on. You
That's
can't
it.
call on me.
Is your vision any different to normal? Blurred vision, tunnel vision? Oh, you have got quite a bruise, haven't you? Can we take a picture of your bruise with our tablet?
You'll take it.
Is that all right?
We won't put it on Facebook, don't worry.
Janet had had quite a substantial blow to her head, which created quite a significant bruise. It turned out she was on a blood thinner, which was warfarin. With a head injury, it can increase the risk of bleeding on the brain. Now, not all patients on warfarin banging their head are going to get a bleeding on the brain, but obviously it is something to consider. Can I take your glasses off? Is that all right? Just going to have a little feel around your eye socket, see if we've got any breakages or anything, any bony tenderness around there. Is that all right?
Yes, of course it is.
No pain there? No pain in your cheeks at all? Right, let's have a little feel of your hips. Is that all right? Hey, Rats, is your pain? Is it like here? Is it painful when I press? Is it round here? Ah, right. So it's more your sort of back. Is that painful when I press there?
Even though Janet didn't fall from a height, she's obviously come down with some force. Nick needs to know if she lost consciousness at any point.
Could you remember hitting the door frame? And could you remember, was there any fuzziness? Can you remember sort of hitting the floor? Or did you sort of go out of it for a couple of seconds?
I can't remember going out. I'm up. I had my head.
Okay.
It was a case of ouch.
Yeah.
The risk is, obviously, when you're being on thinners, the risk is bleeding. And obviously, because you've got a head injury, the risk is... I'm not saying you are bleeding, but that's the risk.
The only way to know whether Janet has suffered any serious injury is to take her in for a scan.
You need my hands. You know where I am. All right. Don't go again. Awesome. Anything changes, fall forward onto me. I'm a big cushion, so you can just bounce off me. All right. Come on the ramp forwards. So, see where that crease is?
Yeah.
That's where I want your bottom. Okay. All right. There we go.
Right,
swing
I can help you get legs up.
Is that painful, is it?
No, it's okay.
Do you need anything else, Al?
No, I should be all right. Cheers, Nick.
Thank you very much, Nikki.
She's not going anywhere, she's just
I'm
driving.
driving. Hold on tight.
Janet's husband Colin will drive separately to the hospital.
You got to have a university degree to do all this now, don't you?
I haven't got a degree.
You have?
I'm just short of a degree. I've got a diploma. I will need to top up at some point though, because I don't want to get left behind. Yeah, I haven't been qualified that long.
Have you?
No, January I qualified this year.
Enjoying it?
Not too long, love it, yeah, love it. Just like being back at home, back where I'm from.
Where are you from?
From Stoke.
Oh, you are from Stoke?
So yeah, so back at home, back working in the city I know and love. Yeah, nothing better.
It's good if you like your job.
Yeah.
Life's too short not to enjoy it, so. Years ago, I had to go to the doctor because I was falling asleep everywhere. And I was telling everybody I had necrophilia. So my son said to me, he said, you realise what you're telling people, don't you?
Yeah, you don't want to go broadcasting that to everyone.
It's not really a good thing to tell people that, you know.
No, I wouldn't go shouting that from the rooftops. You might have some funny looks.
My other 2 sons thought it was hilarious, and others tell me. Are we there?
How was that?
That was very good. Well done.
Here, Janet will need an MRI scan to check that there's no internal bleeding. Doctors will also x-ray her hip to see if it's broken.
I like jobs when it's nice and clear cut.
It just makes everything a lot more straightforward.
Yeah.
You've got none of this. Is it? Or could it be? Ooh.
Yeah. This is the reason you're going to hospital. This is the guideline.
Yeah.
Let's go.
I mean, it's just the risk there with the warfarin, isn't
Yeah.
it?
"70-year-old Susan was having a major heart attack when the ambulance got to her. At hospital, she was rushed into surgery to have a stent inserted into her blocked artery. She's now making a good recovery at home and is having regular checkups on her heart. Ambulance crewmates Laura and Kerry were called out to see 94-year-old Pat, who was complaining of chest pains. They found nothing seriously wrong and diagnosed him with a chest infection, which was later treated with antibiotics. Emily, who was trying to look after her young children despite running a very high temperature, was not allergic to her antibiotics. Now her bout of tonsillitis has run its course, she's feeling much better. Stephen called for an ambulance as he was having severe pains in his leg. As he was already on medication for his deep vein thrombosis, he didn't need a trip to hospital. Stephen is still having a lot of problems with painful clots and continues to have daily injections to break them up. After falling at her home, 72-year-old Janet had badly bruised her head. At hospital, the MRI scan showed no sign of any bleed on her brain. She's now making a good recovery.
I think I've had enough today, you know.
Come on then, let's go home.
Let's go home.
She's heading into training next to learn the ins and outs of being a midwife. Stay tuned for Emma Willis, Delivering Babies.